We will implement the necessary changes to eliminate all forms of racism in our healthcare systems.
2020 speech from the throne pledged to address systemic racism and committed to do so in a way informed by the lived experiences of racialized communities, including Indigenous peoples. My recent mandate letter committed to also continuing the important work to address anti-Indigenous racism in the healthcare system. And most recently, the fall economic statement proposed an investment of $15.6 million over 2 years to support the co-development of distinctions-based health legislation with First Nations, Inuit, and Métis partners. Until today, alongside representatives from organizations representing First Nations, Inuit, and the Métis Nation, I was pleased to announce the launch of the process to support the co-development of Indigenous health legislation. And I'm very much looking forward to working in partnership with rights holders, including treaty rights holders. This important initiative will advance efforts to transform healthcare delivery in Indigenous communities by ensuring Indigenous control over the development and delivery of healthcare services, and it will be informed by the work we do here. The federal government will also continue to supporting Indigenous people's representation in the healthcare field and targeted anti-racism training and skills development. We'll work collaboratively with Indigenous partners to develop and share tools and resources to increase knowledge of Indigenous practices and ways of being. We'll also continue to examine how we support healthcare systems to ensure we're working collaboratively to strengthen patient safety. The reports have been done on these issues, including the National Inquiry into the Missing and Murdered Indigenous Women and Girls, the Truth and Reconciliation Commission in Plain Sight's report most recently, and Commission vient report. They will all be used to inform discussions and plans of action. Significantly, as representatives of the federal government, we will continue to hold roundtables in large forums like this one to continue the dialogue, monitor progress across actions, and to share information on best practices, necessary steps, and systemic racism is a problem that is national in scope. There's no vaccine against it. We remain fully committed to continuing the fight to remove the obstacles to equitable, culturally safe, community-led, community-driven, and distinctions-based approaches to healthcare. Miigwech, Nakumik, merci, Marcy Cho. Thank you.
Well, thank you very much to my colleagues and also to everyone who participated in this very important forum. Obviously, people participated with a high degree of vulnerability, honesty, transparency, integrity, and it was really, I think, moving to hear people's experiences, personal experiences.
J'ai été très touchée par les témoignages que j'ai entendus. Les praticiens et individus qui interagissent avec les systèmes de soins de santé et tous les paliers du gouvernement qui ont participé à ce forum. Merci à vous. Il est important de faire preuve de leadership politique ainsi que de leadership institutionnel. Parmi les choses que j'ai entendues à plusieurs reprises, on parle de cet enjeu depuis un certain moment. Il existe des centaines de rapports dont le sujet porte sur l'élimination du racisme systémique, notamment envers les communautés racisées et autochtones. Ce que j'ai entendu clairement de la part des participants est qu'il est temps d'agir.
It was a complete acknowledgement, I think, by all participants that what we're doing is not working.
Tous les participants ont reconnu que ce que nous faisons ne fonctionne pas pour les autochtones. Comme Joyce Echequan a filmé ces derniers instants, malheureusement son expérience est assez courante. Il existe des barrières dans le système de soins de santé.
Amongst Indigenous people that were experiencing homelessness. And I can tell you that one of the more frightening places for people to interact that were Indigenous, that were living in poverty, that often were living with a variety of different medical issues was the healthcare system. And so this was not shocking to me.
Car ces barrières font peur aux personnes qui ont besoin d'avoir accès à ces soins de santé.
From my perspective, what has to happen is that there has to be a transformation of
D'après mon
power.
point de vue,
And
il
we
faut qu'il
talk
existe
about
une
oftentimes
transformation
laying
de
on
pouvoir.
modules onto what exists. And I think some of the most powerful comments that I heard was the need
L'un
for
des commentaires
transformation from within.
que j'ai
And that
entendu
it
et qui m'a
doesn't
marqué
it isn't
est
about
qu'il fallait une
teaching,
transformation
through a series of
depuis,
courses, cultural
ou plutôt en
competence or
interne.
cultural sensitivity or cultural safety.
On parle
There are a variety
d'activités
of different
pour que les
kinds
gens
of
prennent
courses and
conscience
modules
des
that are
différentes
applied in
cultures,
this context, but that
sécurité
many of the
culturelle,
participants felt
etc.
really came
Mais
short
la
of actually
majorité des
truly
participants pensent
sharing
que ce
knowledge
genre
and power.
d'activité
And so today I'm very
n'est pas
excited to
assez.
announce that the federal
Donc
government
aujourd'hui, je
is
suis
investing
ravie
$4 million in a national
d'annoncer
consortium for
que
Indigenous
le gouvernement
medical
fédéral va investir 4
education.
millions de
This
dollars pour un
consortium is led
consortium
by
pour
Indigenous
l'éducation des
physicians in
Autochtones.
partnership with
Ce
the
consortium
Association
sera
of
mené
Faculties
par
of
des
Medicine of
leaders
Canada, the
autochtones
Indigenous Physicians
et avec des
Association of Canada, the College of
associations
Family Physicians of
médicales
Canada, the
au
Medical Council
Canada
of Canada,
et
and
des
the
ordres
Royal College of
professionnels de
Physicians
santé
and Surgeons of
du
Canada.
Canada.
And the consortium will provide that leadership and
Le
implement
consortium
Indigenous-led
apportera un
projects with the
leadership
goal to reform
et
and
mènera
update
des
the
projets
education of
autochtones pour
physicians to
réformer
contribute to ensure
l'éducation
Indigenous
des
peoples have
médecins.
access to
Et
care
c'est pour
that
nous
is indeed
assurer que
culturally
les
safe and
Autochtones
free
aient
from
accès à un
discrimination.
service
So
de soins de
there is
santé
action
de
happening.
qualité.
There are leaders
Donc,
in the communities,
il y a du
in the
mouvement, il y
Indigenous
a des
communities
leaders
that are
dans les
taking up the
communautés,
mantle of change and have the
des leaders qui
opportunity
sont prêts
with the support
à
of the federal
apporter le
government to
changement.
actually lead that change from within.
Et
So
le
thank you very
gouvernement
much for
fédéral
again having us today, and I
est
will
ravi de
say
pouvoir
that I
collaborer.
thank all the participants who again
Une fois de
so
plus,
freely shared their
je
experiences
remercie
in
les
the
participantes
spirit
et
and the hope
participants pour
that
avoir
this
partagé
time there
leurs
will be
histoires et
transformational
anecdotes.
change.
Et cette fois-ci, il y aura des transformations, des changements transformationnels.
Thank you, Marc and Patty. And
Merci,
I'm
Marc et
speaking to you
Patty.
from my home in
Eh
Toronto on
bien,
the
moi, je vous
traditional
parle de chez
territory of the
moi, à
Mississaugas, the
Toronto,
credit,
sur le
where we honor
territoire
all the Indigenous
ancestral
peoples
des
who paddled these
Mississaugas.
waters and whose
Et nous
moccasins
honorons
walk these
tous ceux
lands.
qui sont passés
Merci
ici
à
en
tous
canot,
ceux
qui
qui
ont...
Thank you to everyone
deux
who
derniers jours.
participated in the
Nous
last
sommes
2
tous
days.
reconnaissants
We are
envers Carol Dubé,
all
le veuve
recognize Carol
de
Dubé,
Joyce Echequan, pour
the
s'être joint à nous au
widower
cours
of Joyce
de ces
Echequan,
discussions,
for
pour
joining us
ses
in the
mots et
discussions
pour avoir défendu
and
le
for
principe de
defending
Joyce
Joyce's
afin que sa mort puisse
principle rather,
amener un
so that
véritable
we
changement.
could effect true
We were,
change.
I think that the words of, and I wish all Canadians
Et
could have
j'aurais aimé
listen
plutôt
to really the
que
inspiring
tous les
words, and I
Canadiens et
think the wise and
Canadiennes
inspiring
entendent les
Carol
mots
Hopkins
inspirants et
made it clear
l'inspirante
that,
Carol Hopkins,
that our
notamment,
first responsibility is to
qui nous a
ensure
dit que
a
notre première
future for First
responsabilité, c'est
Nations, Inuit, and
d'assurer un
Métis,
avenir
and
pour
ensure
les
a
Inuits et les
future of hope.
Métis,
As
et ainsi
yesterday,
leur
the
assurer de
elder
l'espoir pour
Edmund
l'avenir.
Sackene reminded us that
Hier,
listening is the first
on
sign
nous
of
a
love,
rappelé
and I
que
think that in our
l'écoute,
October meeting,
c'est le premier
we
signe de
listened
l'amour.
to the
Et je crois
truths
que
of
lors de
the
notre
providers
réunion
and the
en octobre, on
patients
a écouté
and the learners.
ceux qui nous ont fourni
And
la
as well as
vérité et qui nous ont donné
it's important for us all
certaines
to listen.
leçons
Because when you hear the
d'apprentissage. C'est
stories,
important
you
d'écouter parce que
only then can
lorsqu'on
truly
écoute ces
understand
histoires,
how our
c'est
systems
seulement
are
à ce
making
moment-là que vous
Indigenous
pouvez
people
comprendre
feel, how
comment
the
notre
health
système
outcomes are unacceptable, and how bad experiences
donne
make
une
Indigenous
mauvaise
patients
expérience
reluctant
aux
to access timely care.
Premières Nations.
So these past 2
Et
days
ça fait en sorte qu'ils
focused
ne
on
vont
the
pas avoir
solutions,
accès
on the
aux
concrete
soins de santé
actions,
dont ils ont besoin. Alors, on s'est
as
concentré sur
was
des
asked,
mesures
what is
concrètes.
the moccasin path?
On s'est demandé
So,
quelle était la
Dr.
voie
Karen Hill
des
reminded us,
mocassins.
as Patty has said, that
Et comme
tinkering
Patty
around
l'a
the
dit,
outsides is not going to work. She reminded
des
us we have to
demi-mesures ne
rethink the whole
fonctionneront pas.
thing.
Il faut
The years
repenser
of
tout
all
le
the same
système.
words, and Joyce is
Ça
dead
fait
at
des
the hands
années
of our
qu'on
system.
discute de la
It's
même
not
chose et
working.
Joyce est
So
décédée
she's
aux mains de
advised
notre
it's time to
système.
get
Alors
out of
ça
the
ne
box
fonctionne
and
pas. Il faut
reminded that
donc
the
sortir des
system
sentiers
is not
battus.
broken, it was built this way.
Et ce n'est pas
The
que ce
colonial
système
views of knowing
soit
best are
brisé,
not
mais c'est
working.
qu'il a été
And it's
bâti ainsi.
powerful
Et
to
c'est
know
très
that we have to support the building of
important de
Indigenous
savoir
health
qu'on
systems
doit
together on the path to
construire le système de
self-determination,
santé
where
des
their
Autochtones
knowledge
sur
keepers and
cette voie de
healers will be a part of
l'autodétermination.
improving primary
Ça nous
care
permettra
and public
d'améliorer
health.
les
As
soins de santé
grandmother
primaires,
Catherine Whitecloud reminded
comme
us
la
about the social
grand-mère
determinants of
Catherine
health, the
Whitecloud
role
qui a
in
parlé
prevention,
des
and
déterminants
thinking
sociaux de la
7
santé.
generations out.
Il faut
So I
donc
think we
prévoir
know,
pour les
and it
7
was
prochaines
clear that we need
générations.
more Indigenous health
Et Il est clair qu'il nous faut davantage de ressources humaines autochtones, des infirmières, des praticiennes, des sages-femmes et des médecins. Mais on doit s'assurer que les systèmes secondaires et tertiaires sont des endroits sûrs pour les Autochtones, les Métis et les Inuits. Il faut qu'il y ait une tolérance zéro pour le racisme dans cette sphère. Il faut faire davantage en matière d'éducation, mais il faut avoir des données, des structures d'imputabilité, ainsi qu'une bonne gouvernance et de bonnes structures. On a parlé pour reconnaître des distinctions entre les Inuits, les Autochtones et les Métis, ainsi que les personnes qui ont des handicaps, les jeunes également qui ont une voix très forte, qui veulent s'assurer que les aînés dans leur communauté aient un rôle à jouer. Et un médecin autochtone a dit que c'est important de pouvoir marcher et fonctionner dans les deux mondes. Cela sera très important. Dr. Margaret Greenwood, d'un centre sur la santé autochtone, nous a posé la question hier après-midi. Elle a dit à quoi va ressembler ce système pour les Autochtones, les Métis et les Inuits. Je suis content de dire que ce sera un centre qui sera un dépositaire des pratiques pour que ces pratiques soient sensibles au point de vue culturel. Bon, il y a tous les collèges, tous les organismes d'accréditation ont déjà commencé à travailler le travail pour éradiquer le racisme. Ils ont les pouvoirs pour imposer la tolérance zéro. Comme vous le savez, la Commission Vérité et Réconciliation et ses appels à l'action, la numéro 24 notamment, demandent des mesures précises. Il y a également la FADA qui a fait des recommandations. Il doit y avoir également la composante fédérale qui fait partie donc de ces solutions. Comme on l'a dit hier, au fur et à mesure qu'on met en œuvre la Déclaration des Nations unies, on doit se concentrer sur l'appel à l'action numéro 24 qui stipule que les Autochtones ont tout aussi droit à la santé physique et mentale. Les États doivent prendre les mesures nécessaires pour atteindre progressivement la réalisation pleine et entière de ce droit. Nous sommes d'accord avec Richard Jock. Il faut une perturbation créative. Et j'aimerais remercier Dr. McCocus qui a réuni des collègues inspirants qui sont ancrés dans leur culture, qui partagent tous les jeudis soirs et ont partagé les difficultés auxquelles font face leurs parentés non seulement dans le système de santé, mais dans le système d'éducation également. Nous avons donc partagé ces valeurs. On se souvient de Brian Sinclair ce soir et on se souvient de Mme Cook et Joyce Echaquan notamment. Et nous nous sommes engagés à travailler ensemble pour mettre fin à ces tragédies. Merci.
Thank you, ministers. Nous allons maintenant
Merci, mesdames et messieurs les ministres. And we have one question and one follow-up question.
One question, and one follow-up. Operator, over to you. Thanks.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question, la première question, est de Christy Kirkup from the Globe and Mail.
Kirkup, Globe and Mail.
La parole est à vous.
Hi, good evening. Thanks, ministers, for taking the question.
Merci, mesdames et messieurs les ministres, d'accepter ces questions. Quelles sont les provinces qui étaient représentées lors de ces discussions? On a fait allusion à certaines provinces. Quelles étaient les provinces et territoires qui ont participé à ces discussions depuis 2 jours?
Kirsty, I can, unless
Kirsty,
Minister Bennett or Minister Hajdu has a more complete
à moins
list.
que
The list I have,
la ministre Hajdu n'ait une liste plus complète que la mienne. Tout d'abord, Christy,
2 days, there's been about 500 or so participants that fluctuated from high mid 400s to 500.
Donc, entre 400 et 500, dit le ministre Miller, des participants de partout et de toutes sortes de domaines,
provincial and territorial governments, all levels were represented to various degrees, and that we can confirm with the list. There were speakers on the last day that included all provinces with the exception of Alberta and Newfoundland. Minister Dix from British Columbia took some time to offer some words, very poignant ones about point of care. Minister Yann Lafrenière from Quebec took the opportunity to speak about the work that he has pledged to do in Quebec to weed out racism in the healthcare system. From the Yukon, the Honourable Pauline Frost took part. The Northwest Territories, the Honourable Julie Green. From Nunavut, the Honourable Lauren Kusugak. And from Prince Edward Island, the Honourable James Hailward, I believe. And if I haven't missed out anyone of any elected officials, perhaps the Parliamentary Secretary from Ontario, Parliamentary Assistant Minister of Health, not elected officials, but
Et bien sûr, un grand nombre de personnes non élues, mais également beaucoup de gens de la société civile. Question. La raison pour laquelle je pose la question pour les provinces et territoires, j'essaie d'avoir une idée à quel point les provinces et territoires sont engagés à assurer un rôle et que le racisme systémique ne perdure pas dans les systèmes de soins de santé. Étant donné le nombre d'administrations que nous avons, eh bien, ça varie. La Colombie-Britannique a été à l'avant-scène et veut travailler conjointement avec les Premières Nations. Et on en a vu un exemple élogieux. Toutes les provinces et territoires veulent s'attaquer à l'éradication du racisme systémique. Il faut des engagements qui soient...
Look, you're talking to a person who has never experienced any of the issues that were highlighted over the last 2 days. That is probably the case for a number of the provincial partners that were listening. So this was an opportunity to get that feedback and to say and to work with Indigenous peoples to get their feedback. They all know that we can all sit there and make lofty statements, but they will want action in the long term, in the medium term, and in the short term. And I think that's what we've pledged to our territorial and provincial partners to frankly hold each other to account. The reports are there. I've named them. People have read them. The specific clauses that Minister Bennett referred to in the United Nations Declaration of the Rights of Indigenous Peoples are there. Indigenous peoples are looking for us to be accountable and to apply them. And in the cases of their medicines, allow them the space to practice. The difficulty is when you work on the intersection between those practices and to treat them on an equal basis, which we haven't done up to now. I'm going on a longer point than you asked, Kirsty, as I tend to do, but there is an eagerness. I certainly don't exclude trepidation. I think we're all out of our comfort zone. We all know the impact that this is having on Indigenous peoples. There's reports out there to prove it, but there's a willingness to do it, and that's what I think gives me hope. I don't know, Carolyn or Patty, whether you want to add more on that.
Listen, I think I'll just add. I think. Oh, sorry. Do you want me to go first, Carolyn? I'll just continue. So listen, it's a great question, and it's one that I think the participants ask themselves. I mean, there is a difference between saying the right words and then doing the hard work of changing systems, like I mentioned in my opening remarks, that often require more than tweaking on the edges. And I can just tell you, as someone who, as I mentioned, worked in community, that the idea that we can somehow get to this with cultural safety training or cultural sensitivity training without a consistent and sustained effort at organizational levels to have increased Indigenous voices leading at all levels of the organization, a focused effort to employ Indigenous people in healthcare settings, a variety of different healthcare settings, changes in curriculum, like the funding that I announced today that allows for more comprehensive integration of Indigenous principles in healthcare and in healing. I think, you know, the fact that people were there today is a good sign. It's the next steps that matter, and what matters is that desire, and I do believe that everyone does have desire to have a system that's more inclusive, gets translated into tangible action. And I can tell you by watching the work of organizations in my own community, it is hard, it is sustained, and it needs a sustained commitment at the most senior levels of leadership.
Yes, I think that again that with Minister Dix, but also Mary Ellen Trapelafon's significant report that she shared yesterday, and the fact that next week will be her data report. I mean, they listened to over 9,000 people, and had, because of the disgusting revelation around the bingo game in mid last year, the fact that significant piece of work was done in 6 months, with really strong recommendations for everybody, I think speaks to taking that piece of work, and then hopefully there are some federal things that we are obviously working on, but also that other provinces and territories will look to be able to see what they could learn from that report and apply and tweak in their own jurisdiction.
Thanks,
and I
Christy.
I think, Christy, the other thing is that, as you heard, that the Royal College, the College of Family Practice, Accreditation Canada, all of the colleges of physicians and surgeons want to know how they can do better in including Indigenous peoples in the accreditation, but also in terms of the evaluation and consequences of bad behavior.
Thanks, Christy. Operator, next question.
Thank you. The next question, la prochaine question est de Brett Forrester from APTN National News. Please go ahead. Your line is open.
Hello, ministers. Based on these preliminary meetings, what might this distinctions-based Indigenous health legislation look like? Pardon me.
Hi, Brett. Perhaps, as you know, that in both throne speeches of this government, this has been mentioned. It's something that we knew we had to undertake. When I sat down with my team after being appointed Indigenous Services Minister a little over a year ago, we had extensive briefings on the process that we needed to follow in order to move forward on this, knowing the jealously guarded jurisdiction that we were, as well as the political minefield that it represented. If you look at any of the historical relations that we've had with provinces over healthcare, we know that this is a system that has failed Indigenous peoples in a country that we pride ourselves on having a first-class healthcare medical system that has failed and treated Indigenous peoples as second-class citizens. We know that it's been exacerbated by COVID, and so when I sat down, going back a year before COVID, a little over a year, knowing what the challenges that we had faced with C91 and C92 in terms of engagement and co-developing, I wanted my team to take as much time as possible to sit down and talk to treaty partners who often have different perspectives depending on their treaty areas, rights holders of various natures. So really have a long diligence process. The historical epidemic has increased the urgency of moving forward on this, knowing that the socio-determinants of health that have led to the outcomes that we've seen, particularly as tangibly measured in the South to Indigenous peoples that are 3.5 to 5 times at risk to the exposure of COVID. the challenges that we have with respect to housing, which is congregated living spaces, are a vector of transmission of the disease. These are all issues that have made this discussion very much something that is present of mind that we need to move a little quicker on. So forgive me if I don't have all the answers, particularly in knowing what I do over the last year, knowing that when it comes to the particular issue at hand that we've been discussing in systemic racism and racism, I myself have never experienced it with respect to the healthcare system. So this will be a longer process. We've dedicated a good amount of financing in $15.5 million to start that engagement with rights holders to ensure that whatever we come up with reflects those voices, and there will be varying views on it. We heard squarely, and I've seen it throughout the pandemic, that issues of self-determination need to be at the core of the discussion. Federal leadership in the matters of weeding out racism and systemic racism need to be at the top of the discussion, but they need to be informed by those who have that as a lived experience on a daily basis, starting with the community and the Atikamekw Nation, the community of Manawan. It's why we've advanced financing to the community of Manawan to guide us along applying a principle that is focused on achieving real equality in the healthcare system with respect to Indigenous peoples. So it can take various forms, and I think these are sort of the things as politicians you want to kind of have control over things, and that's not helpful in this situation. We have to kind of let ourselves go and be open to criticism, open to change, open to feedback, open to solutions that we may not be comfortable with. People have asked me and asked Carolyn and asked Patty through what are you guys going to do in the short term? Well, we have a real opportunity right now to test what we have said we were going to do. And we've seen the proof of it through the deployment of the vaccines, treating Indigenous people on a priority basis, knowing what we know and our experience through the last 9 months. So you want an immediate action? Make sure the vaccines get deployed in a scientifically proven way to people that are marginalized by the healthcare system in a culturally appropriate way. We introduced healthcare legislation today, but it's been on throne speeches for 2 rounds now over the past year. It's something we've been given a tremendous amount of thought over. This was an occasion to launch it and launch the consultation process and discussion process.
Brett, do you have a follow-up?
Yes, just as a follow-up, Minister Miller, you mentioned Bills C-91 and C-92. What I'm wondering is if you're kind of using bills like C-92 kind of as a framework or a starting point. Is this something that you imagine will allow First Nations, Inuit, and Métis to assert their own jurisdiction over healthcare and the provision of healthcare at the end of the day?
Well, these will be informed by our conversations, Brett. What I do know, and it's measurable through the deployment of financial support and backing and assets that only the Government of Canada can mobilize, such as the armed forces, such as surge capacity that we've been really massively procuring. Is that when those assets are put at the disposition, and when the financial control over these assets can be exercised by First Nations, by Indigenous peoples, by Inuit and Métis, the outcomes are better. They just are. It's measurable. It happens. And I think one of the real successes of the Indigenous Community Support Fund is the fact that it allows the implementation of pandemic plans that are tailored by the community itself, and the proof is there. So I won't presume the outcome of these discussions. We know, and when we heard it from ITK President Nathan Obed, self-determination is key. That is when it comes to the Inuit, there is a different set of considerations than we would have with First Nations. Everyone knows that, but we have to reflect that in our discussions. So that's my answer. I hope it answers it clearly.
Thanks, Brett. Operator, next question, please.
Thank you. The next question, la prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead. La parole est à vous.
Catherine Levesque, Canadian Press. Yes, good afternoon to all of you. Question for Minister Miller. I wanted to continue along the same lines, and I wanted to hear him in French on the bill that includes agreements with Indigenous peoples. What do you seek to accomplish concretely, and how will you apply the Joyce principle? And did you have an idea in mind when you tabled the bill? Well, to be very clear and to answer the question directly, I have no deadline for tabling a bill. I said so to Brett. When I came into this role, it was in my mandate, and there was already a throne speech that announced this project. What I am seeking and what we are all seeking is true equality of Indigenous peoples in the health system. We know very well. We're very proud of our health system in Canada. It is a world-class system, but unfortunately, for historic reasons, colonialism, there is systemic racism against Indigenous peoples, and that makes them second and even third-class citizens in the healthcare system, which is a jurisdiction which is jealously guarded by the provinces. And there are political tensions that have existed for a long time now. It is a minefield, we know it very well. But by knowing this, we know that we can address the issue, and we need to do it together. We need to address systemic racism at all levels of government. Concerning our role of the Government of Canada to Indigenous people, it's well enshrined in the Constitution, and before that as well. So in light of the bills that were tabled very differently from those in the past, there is C-91, the Indigenous Languages Act, and C-92, the Act on Childhood Services, which refer to the tragedy imposed upon Indigenous children. It's trying to rebuild the system, to build acts in partnership with Indigenous peoples. We have not reached perfection. It was very difficult, and I won't hide it. It requires commitment and engagement, but when I assumed the role, I knew I wanted to take as much time as possible with my staff to conduct consultations. And so the sums announced in the fall fiscal update announced $15.6 million. There was urgency, obviously, because of the pandemic, around the global pandemic, and we haven't seen this in 100 years. And this means that this project, and in the light of what we've all seen about the horrible treatment against Joyce Echaquan, which is all too common, experienced by Indigenous peoples, there is urgency to establish and accelerate this process. That being said, we will need to continue the consultation and dialogue with partners, with Indigenous peoples who are claiming this right, a right to self-determination over their own management of their health systems that have been underfunded in the past. It's a federal responsibility, and we talk a lot about provincial responsibility. We see it a lot, and what happens in urban areas, it's unacceptable. There's a lot of work to be done. It falls to the federal government as well. Let's not hide it. All of these elements mean that we will take the time to do things right. The tabling of the bill and the presenting of the bill won't be done tomorrow. We will do things properly. We know that there is urgency. I know that people will ask, what will we do in light of the discussions of the past 2 days? In our own fields of jurisdiction, we have the vaccine deployment that is ethical for Indigenous peoples, which is done in hand with the provinces and territories. And we will need to prove ourselves to Indigenous peoples, because so far things have been successful, but there are many vaccines to be deployed, as you've seen in the last 3 days concerning vaccines entering the country. But we need to do it across our health system, and we need to seek justice and parity for everyone. And in urgent cases, well, to answer, it's a long answer to your question, but we know that Indigenous people are more susceptible to COVID, and that's something that and so they must be prioritized. Is there a follow-up question? Yes, absolutely. Thank you for the response. You said yourself that you're in a minefield, and we're talking about the provincial jurisdiction in healthcare. And you mentioned over the last 2 days that some of the provinces have reacted to say that the federal government is treading on their jurisdiction. Are there some provinces that reacted more strongly than others? It remains to be seen. For elected officials, it's time to listen. And we spoke at the end of the day today, but we were there to listen to their experiences, so I don't think it was the place for anyone to make sweeping political statements. I felt openness from Quebec. Minister Yann Lafrenière presented his commitment to fight racism. I take him at his word. I think he's in good faith. But there is a lot of work to do. And what Indigenous peoples have been saying to us constantly is that we need to prove ourselves. I was very touched by Minister Dick's comments about BC, who said that they need to prove themselves. They need to improve point of care. People, their first experience with the health care system when they're in distress, and that's work that needs to be done. Catherine, I know maybe Minister Bennett or Minister Hajdu might wish to add to that, but that was my impression.
I think that's good.
Mute button.
I had it in French, but Joyce's principle, just to remind people, and it's what we believe, that Indigenous people have an equal right to the highest standard of physical and mental health, with a right to traditional medicines and the conservation of their vital medicinal plants, animals, and minerals. It says that governments must recognize Indigenous rights to autonomy and self-determination in matters of health and social services. So I think that's, in some ways, a little bit being able to assert their jurisdiction in the way that C92 does.
Merci, Catherine. Opérateur, prochaine question.
Thank you, Catherine. Operator, next question.
The next question, la prochaine question est de Mike Lecouteur from Global News. Please go ahead. Your line is open.
Thanks for this. Minister Miller, I know a couple of other colleagues have sort of danced around it. I just wanted to ask you really pointedly. You said yesterday that Canadians expect concrete answers, stop calling things out. So from what happened over the last 2 days, what is actually going to turn into concrete measures to help Indigenous people trust the healthcare system again?
Yeah, and thanks, Mike. It's important. You know, it's if people had a solution tomorrow, it would be an entire misunderstanding of the scope of the problem. And clearly, what we heard today, and as I mentioned to Catherine Lévesque in French, this was time for us to continue our listening to those that have experiences that I personally have never had at all with respect to the healthcare system, because I get the benefit of a first-class healthcare system. Indigenous people don't. It's often second or third. So we did make announcements with respect to supporting the community of Manawan in the sum of $2 million to work on Joyce's principle and concrete solutions that they would like to see. Mr. Hajdu announced another $4 million to support Indigenous organizations and physicians in a number of their initiatives and pushing forward the actions that they would like to take. For me, in my ministry, I announced, and I wouldn't say it was breaking news because we talked about it in 2 throne speeches, but the launch of an incredibly important piece of legislation that will take some time to put together in terms of distinctions-based healthcare legislation for Indigenous peoples, but that will take time. The immediate challenge and the immediate rollout of the vaccines in a way that reflects what we say the healthcare system should reflect is absolutely top of mind to me. So far, in terms of the prioritizations that have been made by the NAC, it's getting long in the day, Mike. NACI, the provinces have been pretty good in prioritizing Indigenous peoples, and we've seen that roll out into communities, sometimes with real logistical challenges. In the case of northern and remote communities, the objective, which is still on track, of getting both doses into arms by the end of March for 75% of the populations in the territories, who are exceedingly vulnerable, not only in their not only in the fragility of their healthcare system, but the ability in the conditions of a housing deficit and cramped housing conditions to have the virus spread like wildfire, with real mortal consequences. And this isn't imaginary data. We can see what's happening in the States with numbers from 3.5 to 5 times the impact of COVID on Indigenous peoples, with a mortality rate that the CDC is quoting at 1.8 to 2 to Indigenous peoples, and even at younger ages. So we're worried about that, and Indigenous peoples even more so, as they're composing with odds that are far greater than non-Indigenous populations. Now, from their perspective, facing a 100-year, once in a 100-year epidemic, the proof is in the pudding, and getting those vaccines into arms in a culturally safe manner. So people talk about short-term deliverables. This will be a chance for Indigenous peoples to evaluate the words that we've said and judge us accordingly. I know from my experience even though I have never experienced the issues that have been discussed over the last 2 years, that when Indigenous peoples have the assets and resources and the assistance of the federal government in a respectful way, the results are there to prove it throughout COVID. And I could get into a lot of the stuff that we've done during COVID, knowing that there is much more to do. But I say that because the issue of self-determination over healthcare is key, foremost as a matter of right, but also as a matter of positive medical outcomes to communities that face lower socio-determinants of health in what we all believe and what I believe to be the best country in the world.
I'd just like to add that, through Patty's department in the Public Health Agency, that the National Collaborating Center on Indigenous Health is really going to be the repository for all of the wise practices in cultural safety, cultural humility. I think a lot of people really like the video that they showed us today, both days during the break, but that was released last week on stigma and discrimination and what that means. And so I think that there is this ability for us to lift up what is happening across the country. Nobody has to start from scratch. And the kind of competencies that all healthcare institutions, all healthcare providers need to understand is something that we can support, but then it will be up to the individual institutions and healthcare providers and centers and hospitals to really put it in place.
Mike,
and if I can,
follow-up? Oh, sorry.
Yeah, sorry for a follow-up. I was just
ahead.
going to say, picking up on what you were saying there, Minister Miller, about the rollout of the vaccine, how much pressure are you putting on yourself? And at the same time, how big of an issue is it to have a proper and a safe rollout of this vaccine to not only counter that history of mistrust in the healthcare system, but possibly take steps to repair that and maybe move on to the road of reconciliation with this moment in time and this vaccine rollout?
Well, Mike, I'm really cautious about drawing any great conclusions about how we've done things at this point. We're still in the middle of a pandemic, and I wake up every day, and I know it's the case for Patty and Carolyn, wondering how we can do things faster. The deployment of the vaccine is I think top of mind for every single cabinet minister, and in my portfolio and the one that touches Carolyn and Dan Vandel's on pretty much a daily basis, getting that into Indigenous communities presents a set of logistical challenges that aren't present in non-Indigenous communities or in a big urban center. I do worry about the Indigenous populations there, but that's a challenge in itself with provincial healthcare systems. We are, one of the key assets that we've brought to bear during this pandemic, which is the result of some novel thinking, is ensuring that the assets and the logistical force of the Canadian Armed Forces, where all the plans start to fall apart when COVID really gets into a community, well, the Armed Forces can step in and help, but that takes an immense amount of planning. My biggest hope is that we'll actually learn something about this coming out from the pandemic. Minister Hajdu and I spoke about this today. We really have to learn some lessons about how we've deployed our assets and how we've served Indigenous communities according to the oaths we all took when getting into office, but also as a matter of human nature. And that involves trusting voices on the ground when they say, "Hey, we've got a problem, you got to move." There's a lot of red tape that needs to get cleared between the time someone says, "Hey, we need some help. Our pandemic plan isn't working despite all our best efforts. Can you come in and help us?" And the time we deploy, for example, the armed forces, and time, if you wait 1 or 2 days, a case can go from 5 or 10 to 200 and 300, and whole communities shut down, which isn't surprising because you can shut down big cities, frankly, if COVID gets out of hand. So there are a number of lessons over trusting people that are telling you what's going on the ground. Working hand in hand, constant communication with chiefs and council and health authorities, making sure the most up-to-date information is getting into communities. That's a huge challenge for us as we deploy the vaccine, working against legitimate fear of the healthcare system in terms of vaccines and deployment of the vaccines in a culturally safe fashion, leveraging assets, leveraging people, and the elders showing the way and using their languages to give people the full complement of information so they can take an informed choice as to whether to get the vaccine. So far, we've been really pleasantly surprised. We're playing with conservative estimates of doses, but I would say there's been about it's closing in on about 40,000 vaccine doses that have been administered in and around 100, closing in on 200 communities, with many clinics being planned over the next couple weeks, and that's pretty impressive given the limited supply. Most of them are Moderna, but in some closer areas with ultra low freezing capacity, the Pfizer option is being deployed as well. But that's a whole logistical challenge that I think we wake up every day saying, "Hey, what's going on, and how can we help, and how can we get things out faster and quicker, and in a way that's respectful."
Thanks, Mike. Operator, next question.
Thank you. Merci. The next question, la prochaine question est de Mackenzie Gray from CTV. Please go ahead. Your line is open.
Hi there. My questions are for Minister Hajdu. Minister, with all the confusion today about 5 doses in a vial or 6 doses in a vial, has Pfizer given you any assurances that if Health Canada says, nope, we're sticking with 5 doses in a vial, that they will come through and give us 4 million doses? Or are we going to end up with only 3.5 million, which is what the provinces were told earlier today?
Oh, well, thanks, Mackenzie. As you know, so I'm getting a bit of a reverb here. So, as you know, Mackenzie, the Major General Fortin gave this update earlier today. We are having conversations with the manufacturer, and this decision still under review with Health Canada.
So you don't know from Pfizer whether or not, if Canada ends up saying we're sticking with 5 doses in a vial, what the delivery schedule is going to look like? Because it seems like Pfizer is going ahead with 6 doses, regardless of what Canada ends up saying.
I'm not going to speculate at this point, Mackenzie. The Health Canada regulators are doing their important work, and the conversations with Pfizer are ongoing.
Thanks, Mackenzie. Operator, next question, please.
Thank you. Merci. The next question, la prochaine question est de Joan Bryden from the Canadian Press. Please go ahead. Your line is open.
Hi, Ministers. I'm just wondering, you've all referred to what you've heard over the last 2 days and how moving it was. Tell us a little bit about the things that moved you the most.
Maybe I'll start, Joan, and I'll send it over to my colleagues. And to the technicians in the room, if you can stop the reverb, that would be much easier for my thinking process. One of the most moving pieces, I think, for me, and maybe it's because I've given birth to 2 children, but the repeated reference to the trauma that Indigenous women face in trying to give birth, well, first of all, not in many cases being able to give birth in community, having to give birth often far away from loved ones, family, disrupt any kind of cultural process that might go along with giving birth in that community, and then the fear and anxiety of obviously what will happen to them and their children, along with the combined anxiety around child apprehension. I think those stories, I don't think anyone can listen to those stories and not just have a great deal of grief for the women that go through this and continue to, by the way. Most women in Northern Ontario do have to fly into larger centers to give birth to their children, and it is divorced from community and often from ceremony that would go along with giving birth in a community setting. So that's, I think, one area that is very touching to me, and it's certainly not new to hear those stories, but I think every time I hear those stories, especially when people share their own personal experiences, it's very, very poignant. I think for me, the stories compound what I mentioned in my opening remarks, that this isn't listen, racism is horrible, but it's not an uncommon occurrence. It happens to Indigenous people, regardless of their own social location, regardless of their own particular status in their community or in the community in which they find themselves. This happens every day to Indigenous people in a million small and large ways. So much so that the Indigenous people that I worked with in community often sought alternatives to traditional care. So, for example, if there was an underground, person who had a little bit of nursing experience, they might seek care from someone that they trusted would treat them with kindness and with respect and with compassion, who maybe didn't have the skills to actually deal with that level of care, over a medical system where they would and had experienced severe exclusion and violence in some cases. And so those kinds of stories that compound those histories, I think, are also very difficult to hear. And oftentimes when we're hearing from Indigenous practitioners, what we're hearing are the need to hide their indigeneity, if you will. And I think one of our speakers talked about that, the need to put on essentially a white mask to make it in a world where being Indigenous and Indigenous ways of knowing, Indigenous ways of medicine, Indigenous ways of healing are not only not taught, but they're not even really accepted. And so this need to sort of walk in this second land, if you will, and negate, parts of them that are really integral to their own identity. Those are also very painful to hear.
I think as well that the death of Silatik Kudvik, who had to come out of Nunavut to give birth and then died of COVID, was very much part of what we heard yesterday from Pautudik, but what we heard at their annual general meeting. This has been really upsetting as the birthing center in Rankin has had to be closed. This is people want their children born in their communities and their elders able to die in their communities, and that we seem to be in the way of that, and in a sort of colonial way. I think I've had the privilege of meeting with the Indigenous physicians every Thursday night since March. I think that all of them have had such poignant personal stories that we heard in October. But, you know, Dr. Lana Potts, for her to be advocating for her patients to actually describe what happened to her as a patient, but also what happened to her in medical school, that this is why it's so poignant and why people think, you know, they've heard all these words before, nothing changes. And I think that these meetings really, no one's saying it doesn't exist anymore. Everybody knows it does exist, and they look at the outcomes and the suicide rates and the ability, you know, for people to just, as we've said, not really want to go to hospital because they had such a terrible time last time, and then by the time they do access care, they're way sicker than they should have been. So I think that it is about raising the awareness and also understanding that from the colleges of physicians and surgeons to Accreditation Canada, what happens when something bad happens? Are there consequences? And I think that all of the accreditation bodies and colleges and are now really deciding they better look at this. This is just not safe system for Indigenous people at the moment.
And I guess my view that I've been reflecting over the course of the two meetings is just, you know, we're talking of the people that have been talking about their experiences, particularly in the medical professions, the doctors and nurses, highly trained individuals. They've had to rise up out of conditions that were unacceptable to become the cream of the crop. It takes pretty good grades to go to med school. I know Carolyn went. I probably didn't have much of a shot, but you know, we're talking about the cream of the crop of society. And when it talks about Indigenous peoples overcoming obstacles to get there, they are great. They are immense, and they face racism and systemic racism every step of the way. You know, someone like Donna Mae Kimilarczyk was the first Indigenous cardiac surgeon and a doctor who is at the Cleveland Clinic. So, you know, one of the foremost institutions in the world still faces these things. And this was the lived experience of many of the doctors that were talking to us about a Medicare system that I feel is the best in the world. And those are these are the lucky ones, educated, that have faced the challenges, that are the ones that have peers that are treating other people like garbage. And I took some time to think about why I was thinking about those that were really the exceptional ones that were being treated, and why I was reacting more strongly to those than everyone else initially. And then it brings it back to what someone like Joyce Echaquan faced, who didn't have familiarity with the medical system and is actually the patient, and is that they're most vulnerable in a racist fashion, and is suffering the effects of systemic racism, reverts to her own language, which a lot of us do in our moments of vulnerability. You know, you think about, there was a story in the news 2 years ago about the transportation of children to the south, and I'm not pointing fingers. The health minister at the time in Quebec had said, and perhaps clumsily because he was expressing himself in not his language, but in English, about the adults that would have been let on board and no accompaniment. And he said something about substance abuse and regretted it, obviously, and apologized, but he hasn't expressed himself. And he said this was not his language, and rightfully presented his apologies. And that, I think that was fixed, and now there are people that accompany their children to the South. But for a lot of kids, that's their first interaction with the healthcare system, being vulnerable in their own language. And think about all those kids that were on the plane and had to go into a care system and be vulnerable and not be able to express themselves properly. So that's a real repercussion of those that don't have the benefits. So I guess I was sort of drawing that parallel, saying there's a heck of a lot of work to do. We know it, and there's still mistakes being made. We know it. It's in the reports. It's my belief every province should probably turn out a report such as the one that Maryland Pelafont did in BC, because they probably have substantially similar conclusions. But these stories are there. They're important, but they also do guide our reflection and how we move forward. I think the focus, because it was people that are working at the point of care for the course of the last two meetings, there's a lot structural that we need to do, obviously, but did focus on point of care. But it boils down to dignity, respect, and equal treatment.
Joan, did you have a follow-up?
No, it's good. Thank you.
Okay, thanks, Joan. And we have time for one more question, operator.
The next question, la prochaine question est de Olivia Stefanovic from CBC News. Please go ahead. La parole est à vous.
Hi, ministers. With the development of this new Indigenous health legislation, does this mean Métis will begin receiving federal health coverage and have their prescriptions covered, for example?
Hi, Olivia. I can't give you an answer right now. These are discussions that we will have to have. I'm familiar with a lot of the criticism of FNIB in particular by the Métis National Council, and so these are, we need to be informed moving forward on what the Daniels case, the Supreme Court, which is a recent Supreme Court judgment, said, and the implications that it has. But those are discussions that we will need to have with the appropriate rights holder of the Métis. So I won't give you an answer on that.
Olivia, do you have a follow-up?
Yes. And with the creation of this legislation, does that mean that your department is moving towards dismantling the First Nations and Inuit Health Branch?
Well, if you recall the history of FNIB, it only recently moved over to Indigenous Services Canada, as it was housed in Health Canada. Prior to that, there's still work to do within our department to make it or to transform it into what Indigenous peoples expect of it. But I most certainly wouldn't at all signal a dismantlement of it.
Thank you. Thanks, Olivia. This ends today's press conference. Ceci met fin à la conférence de presse. Merci.
Thank you. Merci. The conference has now ended. La conférence est maintenant terminée.